Startling. 6 medications that can destroy your brain health immediately. With many years of experience in the medical and healthcare field, I want to share some important information about certain medications that can impact our brain health. Recent scientific studies have shown that there are 6 specific medications that can increase the risk of developing memory loss. This is a concerning issue, but it's also vital information that we need to be aware of. Memory loss is not an inevitable consequence of aging. On the contrary, the latest research shows that we can maintain brain health much longer than we previously thought, as long as we know how to properly care for and protect it. So why can medications that we often think are harmless cause such serious damage to the brain? The answer lies in the mechanisms these medications can affect brain function. Furthermore, as we are treating other conditions, how can we protect our brains from the unwanted side effects of these medications? These are crucial questions, and we will explore and answer them in this video. But first, don't forget to hit like and subscribe to our channel. First, let's take a look at 2 very common medications used to treat digestive and neurological conditions, but which can cause dangerous side effects on brain health when used long-term: Omeprazole and anticholinergic drugs. Although these medications are frequently used and provide clear benefits, many are unaware of the hidden risks they pose to our cognitive abilities, memory, and mental health. So, what are their effects on the brain, and how can we protect ourselves from these potential harms? Let's find out. Omeprazole is a medication in the proton pump inhibitor (PPI) class, commonly used to treat stomach-related issues such as acid reflux, gastric ulcers, and heartburn. While this medication provides immediate relief by reducing stomach acid and soothing discomfort, prolonged use of omeprazole can lead to serious side effects on brain health that many people may not realize. Recent studies have shown that long-term use of omeprazole can increase the risk of memory loss. A large study involving approximately 6,000 participants found that about 10% of people who took omeprazole continuously for over 3 years experienced concerning memory decline. Another study indicated that 33% of patients who used the drug for more than 4.5 years encountered cognitive issues, including difficulty concentrating and memory impairment. So, what mechanisms cause omeprazole to harm the brain? One key reason is that omeprazole can interfere with the absorption of vitamin B12, an essential vitamin for nervous system health. A deficiency in vitamin B12 can lead to symptoms such as fatigue, memory loss, and even nerve damage. Additionally, omeprazole can alter the gut microbiome, which in turn can negatively affect brain function. Since the gut and brain are closely connected through the gut-brain axis, an imbalance in gut microbiota can lead to serious cognitive and memory problems. If you are using omeprazole to treat stomach issues, do not stop the medication abruptly without consulting your doctor. Changes in diet, lifestyle adjustments, and natural treatment methods can help manage stomach issues without the need for long-term medication. Talk to your doctor about alternative options, or the possibility of reducing the dose to protect your brain health. Next, we will talk about anticholinergic drugs, a class of medications used to treat a variety of conditions, including allergies, insomnia, depression, and incontinence. While anticholinergic drugs are effective in treating symptoms such as reducing itching, alleviating anxiety, and controlling bladder function, their side effects on brain health are a major concern, particularly for older adults. A study from the University of Washington, which tracked over 3,500 older adults over 10 years, found that those who regularly used anticholinergic drugs had a 54% higher risk of developing dementia compared to those who did not use these medications. Common examples of anticholinergic drugs include first-generation antihistamines such as diphenhydramine, some antidepressants like amitriptyline, and medications for incontinence like oxybutynin. Long-term use of these drugs can lead to side effects such as difficulty concentrating, memory impairment, and even confusion if taken over extended periods. If you are taking an anticholinergic drug, do not stop suddenly without consulting your doctor. Your doctor can help assess your health status, provide alternative treatment options, or adjust your medication dosage accordingly. If possible, seek alternative therapies to minimize the risks to your memory and cognitive function. Both omeprazole and anticholinergic drugs play important roles in treating common health issues, but their long-term use can severely impact brain health. Maintaining a healthy lifestyle, combined with appropriate treatment methods, is the best way to protect your memory and cognitive abilities. Always consult your doctor before deciding to stop or change your medication, and remember that taking care of your brain health is one of the most important investments for long-term health and happiness. Next, I want to share with you two very common drugs used in the treatment of chronic conditions, but which carry dangerous effects on brain health when used long-term: corticosteroids and benzodiazepines. With many years of experience in healthcare, I understand that while these medications can provide significant therapeutic benefits and improve patients' quality of life, if not used correctly, or if used for prolonged periods, they can have serious side effects, especially impacting cognitive abilities and memory. Corticosteroids are a powerful group of medications widely used to treat inflammatory, autoimmune, and allergic conditions, such as asthma, rheumatoid arthritis, and lupus. They act quickly in reducing inflammation and suppressing excessive immune responses, helping to alleviate symptoms and improve patients' quality of life. However, long-term use of corticosteroids, especially when taken orally or through injections, can lead to many serious side effects on neurological health and cognitive function. Medical studies have shown that long-term use of corticosteroids can cause changes in the brain structure, affecting important areas such as memory, emotions, and behavior. These changes can lead to symptoms such as disorientation, confusion, depression, and anxiety. An epidemiological study in the United Kingdom, which analyzed data from over 500,000 people, found that those who used corticosteroids long-term to treat asthma had a significantly higher risk of developing memory loss and other mental health disorders compared to those who did not use these medications. Furthermore, corticosteroids can alter hormone levels in the body, especially cortisol, the stress hormone. Prolonged high levels of cortisol can damage nerve cells in the hippocampus, the area of the brain responsible for memory and learning. Therefore, while corticosteroids have powerful therapeutic effects, their use should be closely monitored and should not be prolonged unless absolutely necessary. Benzodiazepines are a class of sedative medications commonly prescribed to treat anxiety, insomnia, and other mental health disorders. These drugs have a calming effect on the nervous system, helping patients relax, reduce anxiety, and fall asleep more easily. However, when used long-term, benzodiazepines can cause significant impacts on cognitive function, particularly memory and brain alertness. Many scientific studies have indicated that prolonged use of benzodiazepines can increase the risk of neurological disorders such as Alzheimer's disease. One study demonstrated that long-term benzodiazepine users had double the risk of developing Alzheimer's compared to those who did not use these medications. The brain damage caused by these drugs can be permanent, leading to long-term memory loss, cognitive decline, and difficulty processing information. The main mechanism by which benzodiazepines affect the brain is through their interference with the neurotransmitter GABA, gamma-aminobutyric acid, which plays a crucial role in regulating brain activity. When used long-term, benzodiazepines decrease the brain's ability to learn and retain information, making it harder for users to maintain focus and remember important details. Unexpected surprises: tricyclic antidepressants and statins. We've reached the final section of the list and will discuss two medications that may surprise many: tricyclic antidepressants and statins. Starting with tricyclic antidepressants, drugs like amitriptyline and nortriptyline were some of the first developed to treat depression. While effective in reducing depression symptoms, this class of drugs has a prominent side effect, including memory loss and other cognitive issues. Tricyclic antidepressants work by blocking the reuptake of neurotransmitters, such as serotonin and norepinephrine, increasing their availability in the brain. However, they also have a strong anticholinergic effect, meaning they block acetylcholine, a neurotransmitter critical for memory and learning. Long-term use of tricyclic antidepressants is associated with an increased risk of dementia and other cognitive disorders. Studies have shown that patients using tricyclic antidepressants regularly experience cognitive decline more rapidly compared to those who do not use them. These medications can cause difficulty concentrating, confusion, and both short-term and long-term memory loss. Furthermore, the risk of side effects is particularly high in older adults, who are more sensitive to the anticholinergic effects of the medication. Fortunately, today there are safer alternatives, such as selective serotonin reuptake inhibitors, SSRIs, which have fewer side effects and are not associated with memory issues. Now, let's discuss statins, a topic that has generated much controversy in the medical community. Statins, such as atorvastatin and simvastatin, are widely prescribed to lower cholesterol and prevent cardiovascular diseases. While effective in protecting against heart attacks and strokes, there is a growing body of evidence suggesting that long-term use of statins may have adverse effects on cognitive function. Studies indicate that some individuals who take statins may experience memory problems and confusion. Although these side effects are not common, they can be serious for those affected. It is believed that statins may interfere with the production of cholesterol in the brain, which is crucial for the formation of synapses and cognitive function. Some studies suggest that statins may protect against dementia, while other studies indicate that they may increase the risk of memory problems. The inconsistency in these findings may be due to differences in the study population, the dosage of statins, and the duration of treatment. It is important to emphasize that the cardiovascular benefits of statins are clear, and for many people, these benefits outweigh the potential cognitive risks. However, patients and doctors should have a thorough discussion about the potential side effects of statins and closely monitor any cognitive symptoms that may arise. In some cases, adjusting the dose or switching to a different statin may help reduce side effects. Additionally, patients should be encouraged to adopt a healthy lifestyle, including a balanced diet and regular exercise, to help manage cholesterol levels and reduce dependence on medication. Remember, your brain is your most valuable asset. Take care of it wisely and thoughtfully. Always stay informed, ask questions with your doctor, and make well-informed decisions about your health. Thank you for watching until the end. If you enjoyed this video, don't forget to like, subscribe, and turn on notifications so you don't miss our upcoming content on health and wellness. See you next time.